I use a number of non-drug approaches for patients with arthritis pain. One of them is a full-spectrum CO2 extraction CBD. Another is elk velvet antler. Omega-3 fatty acids play a huge role, as does hyaluronic acid. CBD is a really interesting product. It comes naturally from the hemp plant, and because of that, it works naturally in the body at the endocannabinoid system. The endocannabinoid system is the most extensive receptor system in the body, and actually almost all of our drugs related to pain management eventually work through the endocannabinoid system also. Elk velvet antler is the internal portion of the elk antler during the early velvet phase. It gets harvested humanely, then cut up, freeze-dried, pulverized, and the powder can act as a potent anti-inflammatory and also help build muscle mass. Elk velvet antler is very palatable. If you think about a dog just wanting to chew on an elk antler or any type of antler, they tend to love the powder, and even cats love the powder. Omega-3 fatty acids play a key role for helping manage chronic osteoarthritis pain. At the right dose of EPA, eicosapentaenoic acid, one of the components of the omega-3s, we can get not only an anti-inflammatory effect, but it can also interfere with destructive enzymes in the joint. Hyaluronic acid, particularly high molecular weight hyaluronic acid, provides global lubrication. Relative to arthritis, we think about lubrication in the joint. And while HA, hyaluronic acid, is not truly a pain reliever, anyone can imagine that if the cartilage slides better on itself, patients are also more comfortable. Green lip mussel is an interesting compound. It's been around for a number of decades with early data in rodents and more recent data in dogs. It's useful for early arthritis pain, but we probably have products which are better and more effective. Glucosamine is also another interesting product that's been out for a long time. In and of itself, it's not very useful for arthritis pain. There are some products which are glucosamine combinations, which have small amounts of data that they may be helpful, but really the best use of glucosamine is when it is combined with low molecular weight chondroitin and manganese to provide some cartilage protection.
A black dog always followed me around.